Good afternoon. Thank you all for joining us today. I'm Avital Havusha. I'm the Vice President of Programs here at the New York Health Foundation. We're a private foundation that works to improve the health of all New Yorkers, and we're committed to making grants, but also making a difference beyond our dollars by informing healthcare policy and conducting research, some of it which we'll highlight here today. So thanks for joining us. Before we get started, just a few housekeeping items. We'll be recording the webinar, and a recap will be sent within a few days. Video and audio are disabled for all of our attendees, but please feel free to chat throughout the event, and we'll be monitoring that and sharing questions with our speakers. And finally, we do have closed captioning available. There's some instructions in the chat if you want to use that feature of the webinar. So just to kick us off, a little bit of background. In 2021, the foundation launched what we call our Healthy Food, Healthy Lives initiative to connect New Yorkers to the food they need to thrive and to reduce food insecurity. And through that work, we've been focused broadly on 4 key strategies: maximizing the impact of food benefits like SNAP and WIC, supporting healthier, culturally responsive food in public institutions like schools and hospitals, promoting food as medicine interventions to really strengthen that connection between the healthcare and the food systems, and supporting local and regional healthy food planning efforts to really build that community capacity for a strong statewide food system. And as all of you joining us today here know, prior to the pandemic, 1 in 10 New Yorkers, nearly 2 million or more people were food insecure, with a disproportionate burden facing communities of color across the state. And rates spiked during the height of the pandemic. And while they've stabilized a bit through the help of safety net provisions as the pandemic is worn on, with food prices now at their highest levels in decades, the prevalence and severity of food insecurity are likely to get worse. And so as we launched our work, we wanted to start by hearing as much as possible from the voices of those who are directly affected by food insecurity. So for the first time, the foundation commissioned our own statewide survey. So we would have that data in hand as we move forward to inform our own work and to share with our partners and with communities like all of you joining today. We knew that many surveys quantified the rates of food insecurity and hunger and kind of counted those numbers, but none to our knowledge in New York had quantified how food insecurity is really specifically shaping the lives of New Yorkers locally every day. And so we wanted to dive deeper into those lived experiences of food insecure New Yorkers and also contrast them with the experiences of those New Yorkers who report being food secure. So we surveyed, you'll hear more about this today, 1,500 New Yorkers to learn more, asking questions about how food insecurity affects their health and access to healthcare, what trade-offs and sacrifices they're making to feed their families, and how easy or hard it is for them to cook and prepare healthy meals. And we also wanted to hear from New Yorkers about solutions, like their experiences with food programs like SNAP and WIC, and how those pandemic-related streamlined processes and waivers helped them and how they could be improved. And we wanted to hear from them what policy solutions might resonate with them, ranging from recommendations like making universal school meal permanent in schools and working with federal partners to cover the cost of online grocery delivery, for example. And what we heard about food insecurity was sobering, but not surprising. People spoke of missing meals, traveling significant distances and waiting in long lines, and making perilous choices between paying for basics like rent and gas or getting healthcare and filling prescriptions. And the results were clear that food insecurity is strongly associated with worse health, and that we can't have good health without access to affordable and nutritious food. So stepping back here for today's discussion, we're truly honored to be joined by 2 guests who will provide us with a perspective on how we can translate what we learned into action and to use those results to drive policy and community level change. So first, Jackie Bogart. Jackie Bogart is a community empowerment coordinator at the Food Bank of the Southern Tier. She's an expert in advocacy for mothers living on a limited income and people with disabilities. She's a member of the Tioga United Way Board of Directors and the Closing the Hunger Gap Steering Committee. And she's a graduate of the Food Bank Speakers Bureau. She's spoken at the National Anti-Hunger Policy Conference, the Poor People's Campaign, and she will represent the Food Bank in this month's White House Conference on Hunger. Jackie, thanks for joining us. And then Ray Gomes. Ray is a writer, food justice activist, and organizer. She's a strong supporter of local food sovereignty and is a founding board member of the Central Brooklyn Food Co-op, supporter of a Central Brooklyn Food Hub and the Brownsville, East New York Food Advisory Council. And she holds a Master of Fine Arts in nonfiction from Goucher College and has published in The Nation magazine, Color Lines, The Root, and Civil Eats, among others. So we're so happy to have them join us. I'm going to turn it over to my colleague, Julia McCarthy, for the rest of the session, who's a senior program officer here at the foundation, who led this work and authored the report. Julia will walk us through some key findings and ground our discussion. Julia, turning it to you.
Thanks so much, Avital. I see a few questions in the chat, so I'll address them briefly. I'll start by saying that I'm going to share a few slides with some graphs and some of the data from the report. After that, Ray and Jackie will be discussing the findings of the report. And at the very end, we'll have some time for audience questions, but you can drop questions into the chat at any time as I'll be monitoring that. So without further ado, I'm going to share my screen, and I'm not the best technical expert, so give me a moment, please. Great. So just as a reminder for all of us, food insecurity, which the United States Department of Agriculture defines as a lack of consistent access to enough food for an active, healthy lifestyle, in New York is prevalent, persistent, and very pricey. Food insecurity is not just a problem for the individuals who struggle to afford food, it's a problem for our state as a whole. A 2019 study estimated that in New York, the annual healthcare costs associated with food insecurity top $3.4 billion, or approximately $173 per person. It may be unsurprising that healthcare costs for individuals at risk of hunger are high, but what is surprising is that food insecure individuals are actually twice as likely as food secure individuals to rate their health as fair or poor. We also found in our survey that 21% of food insecure individuals delay or skip medical care, and 13% delay or do not purchase prescription medication. And these rates are even higher for the very individuals we know most need medical care and prescription medicine. 23% of chronically ill food insecure New Yorkers delay or skip medical care, and 16% delay or simply do not buy prescription medication. So with food costs rising across the nation, prices at the grocery store may be giving everyone pause at this point in time, but we actually know that for food insecure New Yorkers, it's more than 6 times as difficult, food insecure New Yorkers are actually more than 6 times as likely to find it difficult to afford food than other New Yorkers. They're also more likely to struggle with transportation and cooking. So for example, food insecure New Yorkers are more likely to rely on public transportation, which can restrict the food and beverages they purchase. As one survey respondent explained to us, we don't live within a reasonable distance of any supermarkets, and we don't have a car, so we're limited to purchasing whatever we can carry on the bus. When it comes to cooking at home, on average, 58% of food insecure individuals have trouble. Time is the most consistently reported barrier, but basics like space for storage and lack of access to appliances like refrigerators are also problems. And so many food insecure New Yorkers have to make really tough trade-offs to afford food and to prepare it for their families. We know that individuals buy cheaper food, and alarmingly, they also stretch food or eat less. Food and nutrition programs can play a critical role in helping to reduce food insecurity, programs like SNAP, WIC, school meals. And the New Yorkers who participate in these programs rate them really highly. We're really pleased to see that. But there are some food insecure individuals who are just not eligible, and many of the programs available to them are under-enrolled. We found that of the New Yorkers who identify as food insecure, more than a quarter do not participate in any food benefits program or emergency food program in the last 12 months. And so when we asked individuals what could help them get the food they need, people unsurprisingly said they needed more money, right? That's pretty obvious. But other solutions were also desired, including financial support for food delivery, help applying for benefits, and improved access to transportation. The other good news is that New Yorkers overwhelmingly support policies that could reduce hunger and improve health. So for example, both food insecure and food secure individuals overwhelmingly agree that New York State should make free lunches available to every student. Given the overwhelming public support for policies that can reduce hunger, now is the time for policymakers to act. And New York officials can take action to improve federal food security programs like SNAP, WIC, and school meals. With that, I would like to invite Jackie onto camera, please. Great. So, Ray, I'm going to start with a question for you first, if that's okay. When reading this report, what surprised you, if anything? Were there things that we should be concerned about that, maybe weren't highlighted?
Thanks for that, Julia, and thanks for having me. Hi, everyone. Ray Gomes. Yeah, I mean, there's not a lot that surprised me about the report. What did surprise me, it's small, but I feel like it's significant. And I think in doing similar work, research work, focus groups, panels, these types of things, I've noticed a similar trend where people reporting on their own experiences tend to rate them probably higher because there's not really like a sort of border or litmus that people are sort of responding from. So I was really surprised by people's self-reported health. That food insecure folks were, saying that their health overall, 40% of them said it was fair, 38% said good. When I have done focus groups in the past, and even supermarket surveys, when I've asked folks about, how they feel about the quality of the food or how they feel about their own experiences, I've found that people tend towards the more positive, even if their experiences are largely not great. They tend to want to not completely demonize their communities or demonize their own experiences or speak about it too negatively. And so I personally haven't found a way to overcome that. And I feel that that may have been a part of this researching and reporting. I read a little bit about, the process. I saw that you all did focus groups, and I'm not sure how to get past that. And, again, in talking to folks who have, been in some of the most dire circumstances when it comes to food access, they still tend to have a pretty positive outlook. They're very grateful for programs and, situations that allow for better access to food. And so when asking them to sort of critique these programs and these different things, or even their own experiences or, how they, see their lives, it's almost as if they're saying it could be worse, right? And so, to get a sort of true sense of, the issues, people's personal experiences, a true narrative of it, I feel like there needs to be a combination of an analysis, right? That, different things need to be taken into considerations. Yes, people's experience is extremely important. They should be centered, but, overall, we should look at the built environment. We should look at the systems, the policies, the laws, and all of those things to truly get an accurate reflection of the situation while we're centering people's experiences. Knowing that, people who are usually on the worst end of, the sort of marginalized of the marginalized are, survivors. These are people who are, largely thinking about how to make their lives better, and typically tend to think that, things can be worse. And so to sort of report it from a place, even if they're criticizing it or analyzing it truthfully, it tends not to make it, say it as bad as it actually is. But that's my main reflection. It's a small one, but I really feel like it's a significant one that folks need to think about more when they're doing these types of research projects.
No, Ray, I really appreciate that. I mean, I also was surprised that I thought the numbers of people rating their health, as only fair or poor were alarming. And yet I also thought when we look at some of the actual data around, rates of hypertension, rates of, heart disease, that oftentimes they're even higher than sort of what's reflected here. And so, and how do you sort of reconcile And I really liked what you said, like centering the experience of people who are living this with other data, thinking about the built environment, thinking about policies. Something that, Jackie, I'm going to put this to you in a minute, but something that Jackie and I have talked a lot about is the toll that this kind of survivor mentality takes on people. And I think when you said people are always thinking it can be worse. And so there's a lot of mental hopscotch that people are playing in this. And Jackie, you talk so beautifully about sort of the relationship between mental health and food insecurity. And I think this is, for many public health advocates, a really understudied and not well understood sort of intersection. I think the public health community is, starting to grapple with it more, but can you talk a little bit about, the toll that takes on people and what the relationship is?
Is that for me?
Yes, sorry.
Thank
I
you,
talked
sir.
too long.
So yeah, I know that from my experience, food insecurity has had a negative effect on my health, on my mental health, my physical health. You can't be hungry for years of your life. My whole childhood, I was living in deficit. Most of my adult life, and my children, we were living in deficit. And if you're not eating healthy, or you're not eating enough, that takes a toll on your mental health. It takes not only that, but the way that you're treated for being poor, and all of that takes a toll. There's no way that you could come out of something like that with no effect on your mental health. And me thinking of growing up as poor and not having enough, as an adult, when I turned an adult, I was already dealing with some issues from my childhood, that put me at a made bigger challenges for me. I had bigger hurdles to get over, and without resources, without role models, without support, how do you do that? And if you don't see it, you don't have any examples, how do you get through that or overcome that? And so I'm 46 years old, and that's kind of been my life, and I've been healing, but I've got a long way to go. And there's if you're talking about health from food insecurity, you have to also talk about mental health, because it's affected. There's no way it's not.
I mean, Jackie, one thing you shared with me too is that there's both the stress of worrying about getting food and worrying to be able to afford food, and there's also the stress of interfacing with the offices that provide these benefits, right? That sometimes you encounter people who are doing their job well and making you feel that this is a right that you're owed, and others where you feel less than human sometimes. And you shared a story about your daughter recently, and if you'd feel comfortable sharing that again, I think that it's a great example of when we think about these programs, really thinking about how we build in humanity and center sort of the experience of the individual there.
Yeah, so about 2 years ago, a little over 2 years ago, my daughter was 4 months pregnant, and the father of the baby passed away. And he was a breadwinner. They lived together. He was a breadwinner. She had a part-time job, but once he passed, the income was gone. She was devastated. Was technically homeless, and went to the Department of Social Services looking for some assistance, for some SNAP. And she called me crying. She was like so devastated from the way that she was treated in there, and left without getting any assistance because of the way she had been treated. And she was already traumatized. She was already coming in there traumatized. And as I'm picking her up, I go in there and I see this sign on the wall that says, "You will be treated with respect," and blah blah blah. None of that was true. And there are no consequences. There's no fix to this. There's no law that says you can't treat poor people like crap. They get away with it. And some people don't believe it, some people don't care, some people are just focused on other things, but it's not okay. And my daughter needed that help desperately in a time that she was going through some major things in her life, and she left. That's how much that tells you about what she was put, you know, how she was made to feel as she left without that assistance. So.
I mean, I think, you know, one of the report findings that we keep coming back to is that 28% of people who are food insecure in New York aren't participating in these programs. And I think that's just, you know, one example of one of the reasons why there aren't. You know, eligibility comes up, outreach for enrollment is another reason. And, you know, as we're talking about sort of next steps and solutions, which we'll get to in a little bit, like we have to be thinking about the human experience, right? Like that is such a critical part of this. And, you know, if we are committed to enrolling, you know, that 28%, like we say we are, or making sure that they're covered, you know, these sort of, you know, individual stories are so important to figuring out how to move forward. You know, another hot button issue, I think that, you know, we need to talk about, in addition to thinking about mental health and thinking about sort of the dignity of the person, is, you know, just how food insecurity affects people differently based on race, right? And Ray, you write a lot about this, and you know, I'm curious. I'm sure you're going to say you're unsurprised, but you know, can you talk a little bit more? We saw that, you know, Black and Hispanic and Asian individuals were more likely to find difficulty affording food, and Black and Hispanic individuals also to have more difficulty, like longer travel times. You know, why is this? Can you help explain to the audience a little bit, like why we see these differences beyond just sort of the data that was presented, right?
Yeah, absolutely. You know, policy has a lot to do with this, and historical policy in particular has a lot to do with this. So redlining, as most folks, you know, are probably aware, you know, was government sanctioned segregation, right? Redlining determined where you lived. It determined what communities were invested in, who can get housing loans, business loans, what types of business loans people can get. All of those things were dictated and, you know, based on redlining as it existed in the 30s and the 40s, but then, you know, really created the infrastructure for how these communities were being dealt with to this date, right? And so, you know, where there was significant investment in communities in terms of resources, that, you know, communities that were mostly white, there was significant, you know, disinvestment, if there was any investment at all, in communities that were predominantly Black and of color. And so I think that when examining the issue around food insecurity for Black and Hispanic folks, Latinx folks in particular, you have to look at the built environment. You have to look at where people are living, how they're accessing food, where they're going for food. And for supermarkets in particular, which is something that I pay a lot of attention to, because mainly because I take a lot of issue with the term food deserts. Food deserts, as it's, you know, described, really centers supermarkets, right? It talks about your distance, the distance a community has to a supermarket. And, you know, I think it's less than a mile, something like that. I can't remember the exact one. And then it also looks at the income tract of that community. And so what it says is that supermarkets really decide whether or not people are getting consistent access to good food. And, you know, there are a lot of reasons why that is a false structure for which to really analyze people's situations. A lot of supermarkets in low-income communities or low-resource communities have very poor access, very poor quality food, and poor quality food that costs a lot of money. So you have that as a consistent thing. And also it doesn't measure other food access initiatives such as farmers markets, CSAs, and all these other things that actually do give people access to high quality food. And so again, it's sort of centering the wrong thing. So you have these communities that through historic segregation are denied access to so many things that create a livable built environment, right? And on top of that, you have investment in these solutions that don't actually increase access to fresh and healthy food. And so, you know, we keep sort of doing the same things over and over again and expecting a different result. And so communities who have been saying pretty much the same thing for like the past 50 years saying that we have poor access to food, saying that in the 1960s, there were a group of domestic workers who submitted testimony to the city council saying that, we shop in our employers' communities for groceries because they have better access to food. And it's the same situation that we're seeing right now. People go to different neighborhoods in order to access fresh and healthy food. I go to a different neighborhood to access fresh and healthy food sometimes. And so even though I'm working on issues within my built environment, within my community to improve the access to food, in the meantime, I do have to go and do, extraordinary things in order to get the food for my family. And that should really not be. So none of that is surprising to me. It shouldn't be surprising to anybody else, particularly if we keep sort of doing the same things and investing in the wrong solutions.
All right, can I put it to you like more bluntly, I guess, like what are the wrong solutions? And then I know that you're heavily involved with the Central Brooklyn Food Co-op and also with the Brooklyn Movement Center's effort to have a food co-op. And can you talk about like what are the wrong solutions and why you're involved in those two?
Absolutely. How much time do we have?
We still have questions for Jackie too. So.
Yeah, I'll try to be really quick about this. Yeah, I mean, I'm going to name things. So, because I think that's really helpful. I think that there are really great people working on policy and working on solutions. I've said to them, personally and in many different contexts that, I disagree with a lot of these approaches. So one example of a wrong solution is something called Fresh, which is an incentive for supermarkets to build in new developments in communities that lack access to fresh and healthy food. And so again, this solution centers developers and it centers supermarkets usually, who, it invites them to come into communities, have a supermarket, because again, people believe supermarkets to be an answer to a lack of fresh and healthy food. So what Fresh does is that it gives developers a tax incentive to build supermarkets in these communities. No one's asking necessarily these supermarkets have high quality food. If they're going to pay people well, which is something, I've really not seen people talk a lot about. If supermarkets are prioritizing hiring from people in the community, which, it's not even a requirement, then are they paying them a livable wage? Because livable wages lead to stronger ability for people to access food and food security, right? And they're not testing to see if the food is going to be high quality for a certain amount of time. Like there's a supermarket within walking distance from my house that just came into the community, and I saw, the way that they sort of are sort of marketing themselves, it seems very similar to a food co-op. So I immediately took issue with that. But then I go to another community with a supermarket with the same name, right? Which has the same sort of thing. They have like the bulk items, and it has, the layout itself looks very much kind of like a food co-op. And then I saw the same supermarket, same kind of branding, but it looked like, some of the supermarkets I would usually see in our communities, where they highlight the processed food and they highlight, discounted meat, and they highlight all of these other things that, make me feel like, the supermarket that's brand new and spanking in my neighborhood that is sort of appealing to this kind of aesthetic is going to end up just like that one in a couple of years, right? So again, sort of censoring supermarkets in this framework, I believe is the wrong approach. And then meanwhile, I've been a part of the effort, as you pointed out, called Central Brooklyn Food Co-op, which a co-op really starts with the community and it centers the community, right? And so what it says is that from starting in the community and creating a path to community ownership, right? What you're doing is ensuring sustainable access to food, but also a sense of self-determination among the people who are organizing this co-op, right? That all of the profits of this business is going back into the community, that profit is not centered, right? Which supermarkets are businesses, they're run by corporations. They're not meant to feed people, they are meant to be a business and create profit, right? In centering solutions where the sort of bottom line is not profit. The bottom line is fresh and healthy access to food, is community-based self-determination, is, centering long-term residents in particular, right? In a gentrified community as such, the one that I live in, where anything that is new, any new efforts, which, co-ops aren't really new, especially in Central Brooklyn, there were efforts to start co-ops, and there was a co-op, in the late 60s, early 70s, under the umbrella of something called the East. So what we're doing is not new. They center the community in a way that, and long-term residents in particularly, in a way that says, you are the people that can decide what comes into this community, what is sustainable, what prices should be, all of these things. And it's such an empowering exercise. For me personally, it's been very empowering to be a part of this effort. And what it also says is that, for folks in the community who have not only lost so much, but consistently see their community sort of change before their eyes, that you really are empowered to create something that is for you and by you and is sustained for you. And so these are the solutions that I believe need to be centered, right? Where you start with the community and you find a way to support the community to sustain itself, and where the profits and the bottom line and all of those things really come and center the people who are at the heart of this marginalization where food is concerned.
Thanks, Ray. That was really helpful. I think what I heard there was both, having the choice and the self-determination, and frankly, like a wage, right? And so also building capital within the community. And, Jackie, you and I have also talked about how when it comes to like food security, frankly, money is the number one issue, right? And so, when we were reviewing the result reports, I said, is there anything missing? What's here? And you were like, well, the tough trade-offs, all of these are true. And there's no discussion about bills, frankly, like how people are doing that. And I'm wondering if you could walk us through like how, what that means on a month-to-month basis for people, what kind of bills people are deciding between, why would money be the number one thing that people are saying would change their lives? It seems obvious, but there's many layers to that.
Yeah. So I know from my experience, I've got money coming in, my income comes in, and I've got to pay bills. I've got a certain set of bills, and you can't always pay all of the bills and put food on the table. Oftentimes you've got to sacrifice some of the bills to be able to eat. I mean, you can't do both. Most times that's just not the way it works. And you have to decide what, if the lights are going to get cut off, yeah, they have to be paid. But if you can put the car insurance off, which you can't, but you can put one of those bills off, then that's what you do. So you can put food on the table. You can't ever catch up. Like there's no catching up. I can't ever catch my breath because, where one thing's paid, there's another thing that's not, or 3 or 4 more things that are not paid. And, I cannot say, sorry, kids, you have to wait to eat till next week. You can't do that. You have to feed the kids. So, it's like a juggling act, and you kind of become a professional at juggling after a while. But, it's especially, if you're working and bringing that paycheck home and you still can't cover your bills, like how discouraging is that? How does it takes a toll on your soul? You can't take care of your family, but you're out there working. You're doing what you're supposed to be doing. You're working a full-time job, and you still cannot, make sure that the kids are eating and the bills are paid. It's, that's a hard thing to live with. It's not fair.
Yeah, no, it's not fair at all. I mean, one thing I will put a plug in, we had so much data from this survey that we will be releasing a series of briefs, and one is looking at families with children. And, we know that during COVID, there have been a series of USDA reports that came out that said that actually families with children, because of the the temporary increase in benefits, that actually families with children were able to stave off sort of the high rates of childhood poverty that we used to see. And yet we know that parents in families with children are often the hungriest of the hungry, right? Because, if there's a hungry child, there's an even hungrier parent, right? That people are feeding their kids first. They're keeping the lights on for their kids or the heat on for their kids and foregoing themselves. And that's frankly, a sacrifice that no one should ever have to make. I think another thing that when we're talking about money coming in and wages, another really important thing is that these benefit programs have to adjust to the cost of living that's realistic in New York State, right? The federal government sets them, and they just bear sort of no relationship, it seems, to the lived experience of New Yorkers. And one thing you shared with me is that you're in this job now where you earn more than you ever dreamed of earning, and yet you no longer qualify for benefits. So it comes with trade-offs, and it's still very hard. And can you talk a little bit about, what people often call like the benefits cliff, which is a jargony term, but may be helpful right here.
Sure. So let me just give a little background. I was on disability for about 15 years. I didn't work. I was stayed in the house, mainly agoraphobic for 9 of those years. And I could have stayed that way for the rest of my life until it was over, and that would have been it. And I wanted better. I wanted my kids to have better. I wanted them to be proud of me. I wanted to be proud of me. Things happened, and I found a way of healing, and I found a support system. And so I worked my butt off to come up out of that. And I am no longer on disability. I'm working a full-time job, and I'm making more money than I thought I would ever make. I was getting about less than $10,000 a year on SSI. Now I'm in the lower middle class, and I assumed that things were going to get better, and I was going to be doing better, and the struggle wouldn't be quite a struggle like it always has been for me. This is the first time in my life I have not qualified for assistance. This is the first time in my life that I am paying all the bills in my house. That feels really good. And I'm moving forward, but at the same time, prices have gone up. I mean, the average household is seeing $500 increase with no money to supplement, the money the extra money going out. And so, I don't qualify for any assistance. I see people getting assistance. They're getting some help, extra help with the PEBT, and that's great. But I get no assistance. I get nothing to help me get through, the hard spots. And, I'm still trying to catch up from where I was before I started working. And so, I'm not to where I need to be yet. I'm trying, but I'm not there yet. And to have a little transitional support would mean the world to me. It would mean that there's food on the table and I don't have to make those decisions anymore. And I wouldn't feel like maybe I should have stayed on SSI because it's security, that's terrible for me to have to feel and think that way. And how many other people are just not able to move forward in a way that they can come up out of where they were at. And I know that I will. At some point, things will be different. I'm still coming out from where I was. I'm still digging myself out of that debt. But, it's a hard road, and I don't have any support and financial support in that system. It's all on me. And that's especially with these price increases, that's a heavy load to be doing it all on my own, just from overnight, just from the Social Security could be gone. And now I've got this paycheck, and with these price increases, it's just not quite cutting it.
I mean, it's so heavy, right? And it plays back into that question of mental health, right? Like if you feel like I can never get ahead, even when I've had this big win, I still feel stuck in the same place financially. It's hard to, frankly, not feel those same sense of anxiety, right? Or not feel that same sense of stress. And especially when you're the caregiver, it's just, it says to me that there's a design flaw, right? Like these programs, SNAP, has a work requirement, and that's supposed to encourage work. And actually, if it were built to really encourage work, you would still be able to qualify while working full time. And frankly, wages, writ large across the board would be high enough that people wouldn't have to worry about this, right? And so I think, it's a really glaring flaw in the way the program's designed, right? It's not designed to actually promote work. If it were, there would be a graduation, and it would really take into consideration the cost of living, based on where you are. And we know that, the cost of living in New York, whether you're in New York City or the North Country or the Southern Tier, is much higher than it is than what the federal poverty threshold is, right? The federal poverty threshold is a joke. So, you know, there's no other really way to say it. So, and I just want to say, Jackie, I know it's, you know, these are very personal experiences. And so we really appreciate you, you know, sharing them. And I think that your work, you know, with the food bank of the Southern Tier, talking about this and training other people, you know, how to do this. Hopefully, like people hearing these stories, it will start to change hearts and minds about and put pressure on officials to really think about how we design these programs. You know, so, you know, with that was heavy. So I just want to take a moment and say thank you.
Thank you.
I'll give you a break if that's okay and turn back to Ray for a minute. So, you know, Ray, we're talking a little bit about, you know, the stories that can change hearts and minds and the data. And I'm wondering, you know, in addition to what you started with saying, like, let's look at some of the policy work. Like, are there other things that are missing from this report that, you know, should we do it again, that we should make sure to ask or make sure to include? You know, what kind of stories or data could also start to build pressure publicly that we should be considering?
Yeah, thanks for that. And, you know, Jackie, thank you for sharing that. I know that that's difficult. I've shared personally some things I've written about my own experiences with public assistance, and, you know, have had a lot of similarities in what, you know, you've experienced, what your daughter has experienced. And what I really think is that, again, these narratives really need to be centered. There were policies, there were, you know, internal policies and ways that these agencies are encouraged to treat people. There's a historical way that, you know, Americans, you know, coming from being a British colony, have treated quote unquote poor people, that really has found its way through the way, itself through the way that people are treated in situations when they are seeking support and assistance. That the underlying thing is that you're not deserving, this idea of like the deserving poor and the undeserving poor. And so I really do think that there needs to be more policies to really address that, and that there should be trauma-informed care in terms of how we are working with folks, and that, you know, that centering not only their needs, but centering every single thing that they need in terms of support moving forward, and not treating them as if they're trying to get over or be fraudulent, because this is not, there's, I think, less than 1% fraud in the whole benefit system in comparison to other things in terms of corporations. There's rampant fraud and not a lot of regulation there. You know, poor people are highly regulated in a lot of ways and circumstances. And it really stems from our underlying feeling of how we look at what we consider deserving and undeserving poor. So I just want to say that. And then, you know, to your question, Julia, you know, there's so many things that really need to be examined. And, you know, I know I pick on supermarkets a lot. I pick on them a lot because they, you know, sort of get to be centered a lot in a lot of our policy and the way we talk about food access. I think that, you know, supermarkets need to be surveyed more. We did a supermarket survey in Brownsville and East New York, and saw that the quality of food that people were accessing was, you know, really poor. It's not very surprising in a lot of full service supermarkets. You know, I feel like they need to be held to account. I feel like people, you know, even within doing the supermarket survey, we realized, you know, to my point earlier, that people were sort of, you know, making ways to assess and analyze that, you know, kind of gave them the benefit of the doubt. And, you know, people, I remember one of the quotes that we got from the young people doing the reports doing the survey, was that, you know, oh, some moldy fruits and vegetables is normal. Like some of, you know what I mean? When we were asking folks to assess the quality, that they sort of would assess it not based on in the way that I would sort of assess it if I see any, you know, mold or rotting vegetables or fruits, you know, that they sort of made a way for it. And they were like, you know, because this is what they were used to. Apologies for the crazy puppy in the background. So, you know, I do think that, you know, on a larger level, that policy, that supermarkets, food stores should be examined and should be held accountable for what they serve people in communities. Another thing, in terms of benefits that I think really needs to happen, there was a point in time under Trump when categorical, now I'm forgetting my terminology, but basically the means by which people could automatically be enrolled into various programs based on their eligibility on another program. I think that needs to be law. That basically happened with PBT, that parents whose children were accessing universal school meals were automatically eligible for PEBT because the kids weren't able to access school meals because of COVID. They were automatically enrolled and got benefits on their card based on that. And that, again, to your point and to the study's point, that most likely was responsible, or at least very largely responsible, for staving off high levels of food insecurity. And so because these programs are bound by grants and bound by I guess states of emergencies and different things like that, they have a time limit. The categorical eligibility, that's what it's called. So I think that should be law for everything, that if you qualify for one service, whether it's SNAP, WIC, temporary assistance, rental assistance, whatever it is, that you should be automatically enrolled in other programs, because these things don't exist in silos, right? And that what contributes to food insecurity is not just a lack of food. It's not, a lack of pantries or a lack of access to emergency food. It's all of the things that occur in our lives. Jackie pointed to, bills that you have to pay, sacrifices that people make in order to thrive, to stay alive, just to survive. And they make these decisions that affect their health, short-term and in the long term. And so, for example, everyone loves to talk about, we have a mayor that is big on food and likes to talk about food and likes to talk about being plant-based. But under this mayor, the rent board, I think they voted 5-4 to increase the rent, I think 3.25 for 1 year and 5% for 2-year leases in rent stabilized apartments. That's probably the single worst thing you could do for food security at this point, right? Because if people have to pay more money for rent, they're going to pay less money for food. And what does that mean for their, for them to access fresh and healthy food, right? You saw in the report that, based on people's incomes and their ability to purchase food, they would go for things that last longer, right? So processed food, which again affects their health long term. And so, these are decisions that people have to make that, really don't have to do with food on the outset, but really do affect people's ability to purchase fresh and healthy food on a consistent basis. And so in looking at food security and increasing food security, there needs to be an examination of a person's whole life, right? What are they paying for rent? What are they paying for utilities? What is their mental health, as Jackie so, rightly points to, right? What is their ability to, work or not work? What supports are needed? All of these things have to be examined in order for people to actually create situations for themselves where they're consistently accessing food. And the last thing I would say, and it's really interesting that I haven't mentioned it yet because I feel like I talk about it all the time, stop investing in, emergency food programming. These are temporary solutions. I know Closing the Hunger Gap as a group, that is their, that's the work, that is what they're moving towards. A lot of these organizations, their budgets doubled during COVID, you know what I mean? And that money is not going to decrease they're not going to decrease food security. They're not going to decrease food insecurity. Sorry. They haven't. They historically have not, right? We've seen that, anytime that there's been any kind of economic downfall, any increase in hunger and food insecurity, that the support for these organizations go up because it is an emergency, and they have been able to stave off, the emergency in terms of food insecurity. But again, bound by grants, bound by money, bound by just, specific programming, they're only able to do that for a short amount of time, and it does not create sustainable change. So I really do think that we need to support these sort of alternative food economies, find ways to support. I mean, it takes longer. You're working with people. It is not the ideal situation, but it is the most sustainable situation to find ways that, you know, communities could be supported in order to address their own issues, have the solutions live within the communities, and have the community members and the community benefit from the success of these programs.
Right. I mean, I think we could end there. But, Jackie, I want to give you a chance to respond. You know, when we talk about policy solutions or next steps, is there, you know, anything that comes to mind for you that, you know, would make a big difference, or something that you'd like to see change in the next few years?
Yeah, I'm big on this trauma-informed care stuff. You know, I've learned so much about myself, and I've forgiven myself for a lot of what I blamed myself for that wasn't mine to carry. To, you know, it wasn't all my fault. You know, I didn't really have a whole lot of options. So, you know, it's not like I had healthy options. I had a couple of options here and there, but they weren't good options. And so, you know, I've learned a lot about myself, and I've also learned a lot about other people and how to deal with other people. And trauma-informed care is pretty big right now. People are learning about trauma-informed care all over the place, and how to deal with people who have had high levels of trauma. But what about the people who are the ones who have been in those traumas, who are dealing with those traumas, have and still are? Why are they not being educated on this? Like, they're the ones affected. They're the ones that are going through this. It could change their lives. It could put them in a different direction. It could explain a whole lot. They could stop feeling so bad about themselves if they could understand it a little better. Why are we learning how to deal with them instead of them learning how to deal with themselves, you know, as well? I just feel there's not enough education on this going around, but it's not going in all of the right directions.
And I think something that really grounds what both of you said is really centering the individual in the policy responses, right? Like, trauma-informed care is so important when we think about benefits access and benefits distribution, you know, really thinking about how this person's going to interact with the system, right? And I think the same is true when it comes to categorical eligibility, right? That, you know, we demand so much of individuals. We ask them to do what you said, Jackie, juggling of all of these programs and all of these rules and all of these benefits. And frankly, that should be the government's job, right? Like, the government designed these programs, they should design them with what the individual in mind. And it should be, you know, if these are truly entitlement programs, they should be easy to access and easy to use and easy to come on and off of, right? And we know, frankly, from our survey, people love the programs, and they're not easy, right? They're not easy. And so that's really our calling, right? Our next step. And you know, because I'm on my soapbox right now, I'll go ahead and say, you know, Ray, you said, like, these are all available because of emergencies, right? But why wasn't 2 million New Yorkers hungry an emergency before COVID? Like, I don't understand that. So, you know, I think this reframing of thinking of individuals at the center of the program and thinking about what constitutes an emergency is really sort of humbling, and where we need to be right now. We have about 5 minutes left, and we have quite a few questions. So I'm going to answer one quickly because I know that it came up a couple times, and then I'm going to throw one or two out to both of you, and then I have some very quick closing remarks. So we were asked what were the methods of the survey. The survey was administered online through several different panels to 1,500 people. 500 people were food secure, 1,007 were food insecure. We had statistically significant, we had an adequate number of people respond from every region in the state except for the North Country, which is why we didn't end up publishing geographic data, but we were able to do statistical significant like analysis on every other region. So this is, you know, what we're presenting here is true about Western New York, is true about the Hudson County, is true about Long Island. You know, it's representative of across the state. If there's more questions you have about methods, happy to talk about them, and all the raw data is available, and we're happy to share that as well. So I just want to pause and say that, since several people asked that question in the chat. I think I'll ask you this one really quickly. If you can answer quickly, Jackie. Someone said, you know, what does trauma-informed care actually look like? And I think that's a question that there's a lot of questions about supermarkets that Ray actually, I think, kind of answered. So Jackie, that's one that I feel like people are still a little unclear on. So I'll ask that like an example maybe.
So I can speak from personal experience. There's a test called ACEs, Adverse Childhood Experiences. It's 10 questions, and it asks you questions about your childhood. And the higher your score, the more traumas you've experienced as a child. And I got a 10 out of 10. There's a possibility of 10, I got 10. And at 4, your health is the chances of you having like heart disease, all of these kinds of things, committing suicide, like all these things increase like crazy amount. And it's been found that your body changes through each trauma, your brain changes through trauma, and you go through every step of life having that in you if you haven't healed properly. And so you're kind of stunted at that place where you felt that trauma emotionally. And so it's hard to function at a proper level, at a healthy level, when you've had trauma after trauma after trauma. And they're understanding this now. This is becoming known. And so people are learning how to build resiliency, and to the importance of support systems, and to understand that the question isn't what's wrong with you, it's what happened to you. And I think I think that's the answer to most of the ugliness in this world is we need to heal.
Thanks, Jackie. And one more for you, Ray. So a question about eligibility, it's policy folks question came up about eligibility. Since many of those are set at the federal level, should we be focusing on the federal level, the state level, at the municipal level? Where would one even begin, I guess?
Yeah, definitely at all levels. It depends on, what your organization is suited to do. New York State Health Foundation is New York State focused. You can focus on the state and I think the federal level. From a city point of view, I think that HRA, the Human Resource Administration, needs a full revamping. I actually saw a question from my former boss from the health department, hi Maggie, about the difference between deserving and undeserving poor, and how to sort of create policies that move away from that. And I think to Jackie's point, we need to stop looking at people in their circumstances as if they've it's all their fault, they created it, they're lazy, they're this, they're that. And so our whole approach to why people are in need needs to absolutely change. Systems create this, right? Systems create who are winners and losers within, our society, and who are able to access things, who have resources. The whole concept of generational wealth is not just about money, it's about access, it's about who it's about how you're able to create a life for yourself, and how you're able to really achieve the things that you want to achieve, not only just based on how much money you have on the bank, but, where you are, what school you went to, right? All of these things affect where you are, your place in this world. And even though I had to access benefits care, I still came from a place of privilege. I'm college educated. I went to grad school. I was able to go to grad school actually because I was going to grad school, had to access benefits. But, I still came from an educated background where I can, access jobs that a lot of people who were in the same office with me could not. And so even though we were all coming from various places, there are certain parts of our identity that made things, easier for some people and more difficult for others, right? I'm also an immigrant, right? I don't have, a foundation and infrastructure of support within the United States. And so all of these factors that contribute to people's circumstances need to be examined. And so we need to really examine systems and not just people, right? And that's one way to really start to change the system. And so that when, I remember a doctor, when we were talking about social determinants of health, she said, I treat systems and not people. And so even though you're looking at the person and you're really centering their needs, you need to be taking off in your head, what are the systemic things that contributed to this person's circumstance, and how can we work to address it both on the personal level and the systemic level, and make sure that all of that is being considered in when we're creating policies, whether at every level, right? Even at the local level, at every single level.
Well, Ray, Jackie, thank you so much for your time. We really appreciate, getting to hear from you, both experts in this. I'll just say to the people on the webinar, thank you all for joining. And if you haven't already, please check out the. I'm on mute. Did I just put on mute? Sorry. I'm dropping. Did everyone hear me say thank you, or was that mute too? Like I said, not great at technology. Okay, so I've dropped the report into the chat. If you haven't had a chance to look at it, please do. The link will be circulated tomorrow with an event recap. And this fall, we'll be releasing a series of briefs on food insecurity that take a deep dive, looking into the experiences of families with children, public benefit participants, and rural, suburban, and urban individuals. And then finally, please check out our upcoming New York Health Foundation events. So on Thursday, September 29th, my colleague Allie will be hosting an event on equitable telehealth access that will explore strategies to support marginalized patients, and we hope you can join us. So thanks again, really appreciate it.